Hello everyone, welcome back to the channel. Our today's topic of discussion is middle ear cleft. So, middle ear cleft, it consists of three parts, that is the middle ear, the mastoid, and the eustachian tube. So, the volume of middle ear cleft is around 6 ml. How? The volume of middle ear, it is around 1 ml. The mastoid volume is around 5 ml, and the eustachian tube is usually closed at rest. So we don't consider this volume. So the volume of middle ear cleft is around 6 ml. So let's draw a diagram to understand this. Suppose this is our middle ear, this part is our eustachian tube, and this is the mastoid containing the mastoid air cells. So this is middle ear cavity. This part is the eustachian tube, and this part is our mastoid. This part specially, it is the mastoid antrum. These are the mastoid air cells, and one connecting part between the middle ear cavity and the mastoid, it is known as adytus. This part is known as epitympanum or attic. This part is known as mesotympanum, and this part is known as hypotympanum. So what are epitympanum, hypotympanum and mesotympanum? Let's understand this. So basically, mesotympanum, epitympanum and hypotympanum, these are parts of middle ear. So suppose this is our external auditory canal and this is the tympanic membrane. This is suppose the middle ear cavity. So this is the EAC, this is the middle ear cavity. So the portion of the middle ear which lies at the level of pars tensa. So this is a pars tensa. The portion of the middle ear which lies at the level of the pars tensa, this is known as mesotympanum. The portion of the middle ear which lies above the pars tensa. So this is the pars tensa over here. It lies above the pars tensa and it is medial to the shrapnel's membrane and the bony lateral attic wall. So we know that shrapnel's membrane or the pars flaccida lies somewhere around here. So this is our pars flaccida or shrapnel's membrane, and this is our bony lateral attic wall. So the portion of the middle ear which lies above the level of pars tensa and it is medial to the shrapnel's membrane and the bony lateral attic wall. So this is known as epitympanum or attic. And the portion of the middle ear that lies below the level of pars tensa. So this is the pars tensa, it lies below the level of the pars tensa. So this is known as hypotympanum. And there is a term known as protympanum. So it is the portion of middle ear around the eustachian tube opening. So it is known as protympanum. Now, what are the relations of middle ear cleft? So in the roof we have tegmen plate that separates the middle cranial fossa from the middle ear and mastoid. So basically this is the tegmen plate. So in the floor we have jugular bulb. In the medial aspect of middle ear cleft we have labyrinth. In the posterior aspect we have sigmoid venous sinus. In the anterior aspect we have petrous part of internal carotid artery lying in bony carotid canal. So in the posteromedial aspect of the mastoid ear cells is situated cerebellum. In the posterior cranial fossa. So there are few cranial nerves which we need to be aware of. One is the cranial nerve 5 and cranial nerve 6. They lie close to apex of petrous pyramid. And cranial nerve 7, the horizontal tympanic part is situated in the medial wall of middle ear, while the vertical mastoid part, it runs between the middle ear and the mastoid ear cells. So suppose this is the middle ear, these are the mastoid ear cells. So the vertical mastoid part of the facial nerve runs between it. So this is the facial nerve, it is the mastoid part. There is a term which is known as scutum. So it is a bony lateral wall of attic or epitympanum, and erosion of the scutum is characteristic CT finding in case of cholesteatoma, which is primary acquired. So it is a characteristic CT finding in case of primary acquired cholesteatoma. Next is the roof of middle ear. As I have drawn earlier, that suppose this is the mastoid, this is aditus, and this is our middle ear, and this is a eustachian tube. So there lies a bony plate above the mastoid and the middle ear, which is known as tegmen or dural plate, and it separates the middle ear from the middle cranial fossa. So the middle ear is separated from the middle cranial fossa via the tegmen or the dural plate. So the part of the tegmen which is above the mastoid, it is known as tegmen entry, while the part above the middle ear, it is known as tegmen tympani, and the connecting portion between the middle ear and the mastoid, we have discussed it earlier, it is known as aditus. The tegmen has a bulge which can be seen from the cranial side, which is known as arcuate eminence. It is due to the bulge of superior semicircular canal. Thank you for watching. See you guys in the next video.